September 27th, 1913 meeting. And it's good to see everyone. We're happy to have Commissioner Belcher with us today. Thank you for attending. And also, where is she? It's always good to see Winnie, and we just want to let you know, Winnie, that we have our thoughts are with you.
And I want you to know how much the support meant. Yeah, I really appreciate it.
If you just stop stealing cookies.
Yeah.
Well, you have all of them. I gave them to you.
Anyway,
Move that thing.
we need to look at the agenda. Have any questions? And while you're looking to see if you have any questions, I'd like to remind you, in accordance with the State Government Ethics Act, it's the duty of every board member to avoid all conflicts and appearance for conflict. And I'm sure that if you have that, you will let us know when that time occurs. Any questions about the agenda? Do I have a motion that we accept the agenda as presented?
So moved.
Second.
Moved. Second. Any questions? All those in favor say aye.
Aye.
We need to next look at the board minutes for the August meeting. Have any additions, corrections? We received all this by email. If not, do I hear a motion that we accept them as presented?
I move.
Move, Barry. Second by Dr. Whitener. Any questions? All those in favor say aye.
Aye.
Opposed, same sign. Thank you. That moves us to good news. Angie?
I love being this.
Well, I like
This is
the
exciting.
good news. Good.
So many of you have heard over the course of the last year around the grassroots efforts in Pittsburgh with the community there. And in Becky's shop, Keenan and Rashida are our core leaders in that initiative. So as you know, they presented at the last board meeting. One of our own board members, who's not here today, Ken Putnam, heard one of the requests that they made and that they have been talking about for about a year, which was for a crosswalk so the kids could cross over Amboy Road and get to the park. Wellness and exercise. So Ken heard that. He contacted his NCDOT partners, and we now have a crosswalk at Amboy Road. Thank you to the work of Rashida and Keenan and that community group who were very active, and also thanks to Ken.
Thank you. That's wonderful. I did receive that little message that you sent him, and I thought it very appropriate. It was a nice thing that he has done. Thank you for reporting. That brings us to Jim, and we got rid of the 2013, now we're 2014.
We're now in 2014 and soon begin the process for 15. Good afternoon. Your iPad, if you'll select the foundation worksheet tab, you'll see the financial dashboard. Yes. You will see the financials for the month ending August 2013. We are now 16 2/3 of the way through the fiscal year. Just to highlight a couple of things, we're right on track. Overall, we're right on track with exactly where we need to be. Some areas where you would see where we would be over 16 2/3 of the way through the fiscal year is both in DSS and in public health and the administration line item, and that's due because we pay premiums for unemployment insurance and workers' compensation. We pay all of those premiums. That's the first month of the year, so it skews the financial perspective there. With aging services, you see we've spent 50% of the budget for those, and if you remember, we contract for aging services, so we pay half of those dollars up front to allow the organizations we contract with the Sky Regional Council. And if you remember, they are the ones that administer those funds to organizations to serve the community with aging services. Otherwise, we are within our budget constraints for DSS. And if you'll scroll down to public health, you'll see that we are likewise As I said, with the administration, we're slightly above, and that's because of the prepayment of the insurance premiums, but the other lines are well within the target range, and we're meeting all of our obligations. I'm happy to answer any questions that you might have about our financials. Thank you very much.
That's pretty good, thank you. That leads us to the main show today. Lisa?
So I'm excited to come today and speak with you because there is a lot of, or many different things that we're working on, and they seem to be coming together, and so it's always exciting when you know, till the soil and start planting seeds, and then you can start to see the fruits of your labor. So today's, I'm going to be reporting on 3 different things that we've been working on. But before I get started, I just want to talk a little bit about what drives me, and it is really, for me, about building social capital in this community. And I'm just so acutely aware of how each person sitting at this board has such tremendous power and potential to really strengthen the fabric of this community, to the work that you do as a board here, but also the work that you do in your job and the work that you do as you're out in the community. And so social capital is really about those networks of relationships that are created where we live. And those networks are what enable this community to function in a way that improves health and safety, and to function in a way that there's intention in what we're doing. We're all about, with these networks, trying to create cohesion and trying to exchange resources in a way that lift up the community. And so this is an area that I'm very passionate about. There are different types of networks, and there are 2 main ones, and you can have what you call a bonding network, where you're really, it's a group of people where you're trying to create an inner cohesion and bonding and strong sense of belonging and trust. And then you can have bridging networks where you have, like here and here, where you're connecting this network here with this network over here. And you all, as community leaders on this board, really function many times as that bridging network. And it's a very important part of the whole concept of the integrated health and human services. Is this idea that you come here, you gain information, and you're going back out because you're connected to other health and safety institutions, and that we're working together. I think the network picture is nice, but it's a little sterile for me, and I tend to think in color and in images. So to me, it's all about you guys as community pollinators, that you guys are the bees that go out and around in this community from different organizations, and you connect, you collect that pollen, okay? And hopefully you leave these meetings totally coated in pollen, dusted up, so that when you're going back out and doing your work, that you're carrying that information, and we're looking for those connections. I think the example of Ken Putnam is just a great example. Ken came to this meeting, got covered in the pollen, and what was needed in PBA, he went out and he created something amazing. I think the work that Rashida's and Keenan have been doing in his review of pertinence is another great example of that, a work that happens of bonding, where you're creating that interior sense of belonging and community, and really trying to lift the community up to those networks that you're creating. So can you just keep that image in your head as we talk today? That will be helpful, because we're going to talk about building that social capital, both in our community advisory committee, our communication team, and in the diversity engagement coalition that we've created. So the first thing I want to talk about is the community advisory group, and we have people in the room today who are part of that community advisory group, including Jerry Rice. I'm going to let you guys introduce yourselves. If you don't mind, stand up real quickly and just introduce who you are and your role in the community advisory board. That would be great. So Jerry, you want to lead us off?
I'm Jerry Rice. I'm from out in Candler. Is that all I need to say?
For right now?
Okay, right now.
We love you, Jerry.
Does everyone introduce yourself?
Deborah Miles, Center for Diversity Education at UNC Asheville.
Jennifer Johnson, I'm Secretary of the Community Advisory Committee.
Julie Montedeo with Health and Human Services Support Team.
Betty Molinor, Medical Director of Health and Human Services.
Terry Van Dyne, I'm co-chair.
Deanna Williams, Asheville City Schools.
Karen Greer, parent of a consumer.
Kathy Avery, Asheville Doctor Institute.
Frank Castellenko, co-chair.
John Whiter, optometrist.
I was just having a community advisory group. Sorry. Better too many introductions. I just wanted you to know, we've had a lot of people that wanted to be here today, but the community advisory board is made up of people that work, and oftentimes work more than one job. And so we're fortunate to have at least 3 people here today, but there were many others that wanted to be here that weren't able to be here. So what is the purpose of the community advisory board? On the web, you'll see our goals and our and the different objectives that we have, but I wanted to just boil it down for this meeting. We're really about trying to inform the board and influence the board through community input. So we want to have good representation in this meeting. We want to have a forum or a space for people to come and then provide information about ways that we can improve health and safety within our community. We also want the board to do their best to help inform and educate and strengthen the community in ways that helps people that are on that advisory board. So example, Ken Putnam, again, it's such a beautiful example, finding a way to help kids to get the needs identified. So we said, these kids don't have safe access to that water park, and then we were able as a board to answer that. We want to grow leadership capacity in our community, so we're taking regular citizens who live very busy lives trying to manage raising families and juggling jobs, and we're bringing this to the committee, and we're trying to give them skills so that they can then go and be a voice in other boards throughout our community. We want to build that social capital and confidence in Health and Human Service as a receptive agency, as an agency that is willing to listen and to take that input and do something. So it is about building strength and resiliency. The International Association of Public Participation has great information about how you create community engagement and the levels or the continuum of doing it. It starts out with informing, and then consulting, involving, collaborating, and empowering. So this committee is getting formed. It's hard when you meet once a month and you have people that can come 1 month but can't come the other. So we're we're moving along and creating cohesion. We've been focusing on informing and consulting, but our ultimate goal is to hope to move toward more collaboration and empowering as this group forms and gets solidified. And again, we want to increase our effectiveness as a health and human service organization. So the most important thing is to start out and be able to listen, to be really good stewards of listening. And to do that, it's really important to step back and be willing to change your perspective or to hear things that you might not want to hear that makes you feel uncomfortable. And so we have been working on that as a group, and it's been a very, for me, it's been a very interesting journey and a helpful journey for me. I'm going to talk about that in a minute a little bit more, but Frank has an exercise that he's going to queue up for us. But like he's doing that, I'm going to ask you just to look on your iPads. There's a thing that talks about the 13 essential assumptions for a collaborative culture. And I think this speaks, if you can pull it up, I think it speaks really to the challenges that you have when you bring diverse people together into a room who don't know each other. It's not like they're neighbors. It's not like they've built any kind of relationship outside of this group meeting. And they each have an experience that you're bringing into the meeting. And so we want to create a space where people can value that perspective, and that also that not only do you value that perspective, but the people that are speaking, that they learn how to have the confidence to articulate their own perspective and own that perspective. So Frank's going to run us through a very quick exercise that's going to help you kind of see how we all have different perspectives we bring into situations that affect our ability to relate to people as we're trying to create this group of cohesive and functioning community advisory committee.
So good afternoon. Once again, I'm Frank Castablanco, and I am a nurse. So I have taken care of many, many different types of people, and this is an exercise that we have done in a lot of situations in the hospital just to help think a little bit differently. So what I want you to do is I want you to look at these 4 categories, these 4 different types of people. So here you have a pregnant teen smoking. In the back you have a 56-year-old homeless person with just raggedy pants, they're kind of dirty. An 18-year-old with a white t-shirt, droopy jeans, and a black hoodie. And up here on the right-hand side, you have a same-sex couple holding a baby. Now, I've taken care of all of these people. We have seeing all these people in our community. So the question that I want to ask you is, I want you to think about who would you feel most comfortable with if you were standing next to them at this stoplight right outside the door, or behind them in a supermarket. Who would you be totally fine with, wouldn't even think twice about? You don't have to answer. Just think about it for a second. And then the second question of that is reverse it. Who would you feel most uncomfortable with? And then the last part about it is, who did you picture? And think about race. Think about gender. Think about ethnicity. Because all of these things make up who we are. It's part of our culture. It's how we were brought up. We were brought up in many different facets, but we all live here in Asheville. And I think that's one of the important parts about this community advisory committee, which is amazing, which in itself is very powerful. So this exercise is meant to help you just think a little bit, to challenge yourself, to really think about if you do have any biases. If you're comfortable with everybody, that's great. But it's very hard to get to that point. It's something that you have to work on. And there's lots of different ways to work on this. There's lots of different exercises. But beginning to create that awareness helps us to connect more with the people that we want to try to reach out to and provide services to. And that's what we've been trying to do with this community advisory committee, is to bring everybody in and to hear their voices, and more importantly, to hear what needs they have so we can connect better and we can have better outcomes. Any questions? This was 30, 40-minute exercise that we just did in 3 minutes. And stay afterwards and debrief with anybody if anybody has any questions or wants to talk about it more. Thank you.
Thank you very much. I think it's been such a joy to that exercise. I think is really important because it illustrates for us, that when you do bring people together from so many different backgrounds, there's work to be done. We know that we want this diversity of perspectives. It's really important. That's what this advisory group is all about. We also know that we need to create a dialogue that arises from this interplay with what happens in these rooms. We want stories. We want stories that have that full emotional content. It's important. Those stories are what inform us in ways that move us to do things differently. We want to create an environment where we can exchange facts and information. We can share principles, reason, intuition, ideas, and create compassion. And that is the beginning stages of what an advisory group is all about. So again, for our advisory group, the column that we have are these different things. It's that perspective that people bring. It's the stories. It's the ideas that come out of it. It's the knowledge and facts that we share. And they result in intuition and compassion that we develop. And we've kind of had this journey with the group. It started out that a lot of the talk initially was about previous history that people had had with health and human services, and whether that was positive or negative, and what it felt like to walk through the door, across the threshold, to have to come in and ask for help for the first time. We talked about living in poverty and what that's like to do every day, and the stress that happens because of that. We are trying to just constantly move forward, but things are pulling you back, and what that's like. Frank gave a very great conversation about the health cliff and the concept of that, and how people have different support services and how that impacts your ability to be healthy and to stay safe. We talked a lot about the pain of discrimination, how that's just another layer of stress that people have. And had somebody speak very poignantly about how every day they have to get up and put their game face on to start the day and say that I'm a person of value and that I matter and I have a place at the table and I need to go out into the world. And what that's like to do every day when you get up and get dressed is very different than what it is for a white person. We've talked about stress and how it's embedded in our bodies and how it shapes our health and how it can actually affect the morbidity and mortality that we have. Marion was part of that. Mary's on the committee as well. We didn't get around to introducing Marion Aldridge. And Melissa Baker gave a great presentation about that. So we're informing members of the group too, so that they understand what's impacting their health, and we're educating each other, just as we did with Frank's talk. And then we had them map their individual trajectories of health and safety. We have that as a PDF, and you can just look through it, but we went through kind of a guided, structured self-reflection interview where we asked ourselves, is my health, what are the incidents in my life that have affected my health? What factors, positive and negative, are there? And is my health in general, am I on a positive trajectory or a negative one? We did that for safety as well and well-being. Again, trying to get people to think introspectively about themselves. And then our next exercise as a group was to look at that as a community and start mapping assets within our community, so we can again look to see where there's opportunities to develop further strength-based assets in our community. All of that heading toward an increased health and safety through the input of community members. There's 3 tests for dialogue, and dialogue is this thing that we're trying to generate. Is it deepening understanding, and is it building relationships, and is it expanding possibilities? I think I'd like to just let it, we have community members here who introduce themselves, and I don't want to put them on the spot, but if you could speak at all about the community of, the quality of that dialogue, I think it would be good for the board to hear that, what it's been like as an experience. So I'm going to pick on Kathy because Kathy very articulate and used to speaking in public. So
Now I have to articulate. I want to start, when you were saying that, I want to start with 3. Is it expanding possibilities? And the answer to that is yes. Because in a community where so many people, and you don't know the statistics, which I'm sure most of you do, about the Asheville community and how the poverty levels here are huge. And it's just overwhelming to me when I'm out, because at a Bible we go door to door. And so I'm knocking on people's doors and I'm really seeing it just like it is. And to go out and see the distrust in our community and how you have to take care of that first, and you can think any program you have is going to work, and it will up to a point, if you like the old model and the old successes. And if those successes work, then we wouldn't be in so much need, and there wouldn't be so much poverty, there wouldn't be so much mistrust, and other races would not have all these obstacles to overcome. So for me, the old model doesn't work. So for us to be brave enough to listen and do things in a different way, and the first thing is pulling in the people that you're trying to help. So even though they may not have the education, they may not be articulate, they may not be where you think they should be, for you to get to that expanded possibility, you're going to have to build trust, you're going to have to be able to listen to people that may not speak or understand the way you do, and you have to be able to go where they are and understand the way they understand and listen to them and incorporate what they're saying into what it is you're trying to do, because you can't help people. And that's the second thing you're going to require. The second thing is you can't help people without asking them what they need and respecting what they tell you. And if you have to incorporate that into, well, I know what you really need within yourself. I know what you need. So, and what you're saying is probably not what you need. But you have to be able to figure out how to make both things work. What you know they need that you're trying to give, because that's your goal. But what their goal is may be entirely different, and what they're saying immediately that they need that you had not thought of, if you get to that first, maybe the goal that you've been in there with, you can accomplish.
Well said.
So then what that means to me, because I work with Kathy a lot of schools, is the communication. I think, to me, I think when people are talking, to most people, you are listening to a point to them, but you're also processing what they're saying and trying to think of how to respond to that. And what that has looked like for me in my classroom is not doing that, just really hearing what the person is saying, really focus on what they're truly trying to tell you, because they're processing everything around them too. And the best way to get it done, sometimes the adults aren't going to help you, is talk to the children. The children look and see what's going on around them all the time, and they're never allowed that opportunity to say what it feels like inside of them. So what they do is they act out. They start hanging out with people that are going to give them their voice, but which causes a path of violence and misunderstanding and the distrust. And so I think what we should be practicing also is just giving the children their voice, letting them talk to the adults around them, hearing what they have to say, and then taking that information and then going to those parents to figure out how we can assist them, because their child is going to be in their society one day, in a job, taking care of somebody that could be in this room, and we want them to have that confidence and that education to do that well. So.
Sorry, I can't hear you.
Is there anything you'd like to add, Gary?
One thing is a great experience to go through this myself because of living in the country all my life. I was never connected to the city in a way that people in the inner city has so many diverse problems. And, you know, I could get out, I could go, I was free to roam, I could do a lot of things. And I had a lot of supports in place. I had a community, I had a church, I had a family, I had brothers and sisters. But when I saw the diversity in the city, it's not that way. They don't have that support system. And that's where we have most of our assets and money is focusing on the city, and I understand why now. One of the other things that comes to my mind is that we need this kind of support in the community now. Our culture has changed. The country ain't like it used to be. They need the same kind of help the inner city does, but there's too much pride in them a lot of times to speak out. So one of the things I'd like for board members or anyone is to help us figure out a way, how can we reach out to the communities outside of the city and figure out a way to work out these problems. Thank you.
Thanks, Jerry. Jerry brings up a really good point. We do have really good representation from the city, and we want a broader representation, so I'm glad we have commissioners here as well, because you are out in front of me all the time, as everybody else here. We are welcoming new committee members, so we get that broad representation from all over the 365 miles that Buncombe County is. So we'd be very grateful for further, and for youth as well. We have one girl on the committee who's younger, but any kind of youth representation, we're working with Eric Germer as well to help him bolster that as well, because we want to build new leaders. So I'm going to transition just a little bit now from the community advisory group to talk about work that we're doing with the communication team, because they're actually very linked in many ways. And we're trying to brand Health and Human Services so that we have an identity out in the community, that people, when they see Health and Human Services, they know what they can get from it, and the services that we're delivering and the actions we're taking. We've been focusing on these communication platforms that focus on individual responsibility and community responsibility, and we'll see some examples of that in a minute. I wanted to just show you that we've created this internal website for our staff that's just being launched, where it has all these communication materials that really help to brand what we're doing in a way that we hope is more effective. So it goes from the type of font that you use and the color so that it's readily recognized as Health and Human Services, to pictures and graphics that people can use, to key messaging, messaging platforms, and it's all here and available for our staff. So this has been a big undertaking by the communication team. Ben and Jennifer in the back there, and Julie Montaneo, they've been very instrumental in this. I'm really appreciative of the work that they've done. The community advisory's role has been great because we've been creating materials, and then we can take it to the committee and say, well, does this work? So what we ultimately want is this, if we're back to the B image, we want these hives and networks that are thriving because we have really good communication, that we're reaching out in the community with good messaging, and the community is reaching back to us and telling us which messaging resonates and what they need. So you have this in your iPad as well, but this is another example of that inform, empower, and collaborate that I showed you earlier. But they give you examples of what people can do on these advisory committees. They can create fact sheets or websites or open houses. You can have public comment focus group surveys and public meetings. And so that's part of how we'll engage the community advisory group going forward. What we've done to date is we've given them posters and things that we've developed and say, does this resonate? Does this work? And so early on, when we were doing a campaign to try and decrease abuse under kids under 6, we all thought that this little boy was just the cutest thing in the whole world. Did it again? We thought he was the cutest thing in the whole world. That was our favorite poster from staff, right? We took it to the advisory group and this was the one our staff thought was horrible. The advisory group said, no, this is the one that speaks to us, because guess what? Parenting is really stressful. And that was the one that they wanted to see. And so they informed us. And then we changed. And so that one was the one that we used, and we created more that looked like that. We had created these messaging platforms. We worked with a consultant. We thought we were doing really well. I was using the best information from Robert Wood Johnson Foundation, and we were going to do this Choose Better, Live Better, Buncombe County Cares. And we took it to the committee, and it fell flat as a pancake. It was like, us choose? Do you know how limited our choices are? Do you know how hard it is for us to have any choice in our life? That doesn't resonate with us. That just makes us angry. We talked about switching it so it says Buncombe County Cares, Choose Better, Live Better. That softened it a little bit, but it was still, it made people angry. The only one that came out of the group, we had 8 of them that they really liked, was Building a Better Future Together, one choice at a time, because it indicated partnership, that they didn't have to go it alone. So again, we got great feedback from the committee. We thought we were doing something great, that we're trying to communication out in the community and back and engage people, but it took the community advisory group to help us understand it better. This is a campaign that we did on the communication committee that didn't involve the advisory group, but I'll tie it together in a minute. It was Fight the Bite, and we've had rain with this increasing mosquitoes. And so we were really trying to go actively out in the community and decrease the mosquito population. And so this whole concept of tip and toss, that if everybody just gets rid of any of the standing water around their house, and if we all do that, then collectively our community will be protected against the increasing mosquito infestation. So we created this poster, which I thought Ben did. I thought it was just a fabulous poster. We have these wallet-sized cards that we give to people that you can just put in your wallet. That's the front and back of that card. That just gives them information about how important it is to tip and toss and what to do with that. And then we created this video that I wanted to share with you. You got a link to this a while ago, but I don't know if you've watched it. Let's just watch it real quick.
We are the Girl Scouts of 71537 and the Boy Scouts Troop 76 in Buncombe County, North Carolina. And we are here to bring you an important message. Did you know that the more it rains, the more mosquitoes we have? Mosquito bites are itchy. They can also make you sick. Mosquitoes don't travel very far. If they were in your yard, they would probably warn you. Mosquitoes can breathe in very small amounts of water. Start your 2 easy steps. Tip and toss. Tip and toss. Tip and toss. Tip and toss. Stand in water every 3 or 4 days. Like a bird bath. Plastic swimming pools. Old tigers. Flower pots. Dog bones. Even bottle caps. So take small steps. Next step. Big tip. Tip and toss to keep you, your family, and your neighborhood mosquito free. For more information, visit BuncombeCounty.org. No bites.
So it's really great when you work with talented people. But what I love about that video and that campaign is that it's all about social capital. It's about individuals understanding their role and then working as a community together to make sure that you eradicate the mosquitoes in our community. And to me, it's at both of those levels. And I love that video too because it shows kids as effective agents. You know, the other day we were talking about kids. Those were kids from Piscataway. And they were telling the adults what they needed to do. And they saw themselves as actors in their environment, as people that could do things. And so I love that weaving and that creating a social capital through that communication, using the work that we've done in Piscataway and tying it all together. So it's exciting to me when that happens. And we're almost done here. And then the last stage I just wanted to talk to you about was the work that we've been doing for the Diversity Engagement Coalition, and I'm very excited about this as well. For those of you that have been on the board, you'll recall that in April we had Robert Livingston come and speak to us at the Diversity and Inclusion Conference. It was the first time we'd ever done a conference like this. We hosted it with the city, and we had, it was sold out, full house, 250 people, I believe, that came to it, and it was at UNC Asheville. Did it with the Center for Diversity Education work that we've been doing with Deb Miles, and they were partners in it as well. And this conference was fabulous. We had people from across the community coming together, a lot of energy, a lot of momentum. But we asked ourselves, so what? What are we going to do next? And Deb and I have been working since that time. We brought together anchor institutions in this community, AV Tech, the Chamber of Commerce has just come on, Buncombe County, the City of Asheville, Mayhack, Mission Health, and UNC Asheville. And we've been working together to say, what can we do in our community to really, and Frank's been a part of that as well, to retain the minority and ethnic diversity that we have right now in our institutions, and how can we do that together? Because we know in Buncombe County, this isn't a hugely diverse community. And we know anecdotally that we can attract professionals here, but they don't want to stay because they don't feel connected to our community. So what we're trying to do is, by pooling our resources across, we're trying to create a community across these institutions that creates that connection, belonging, and that professional support for unrepresented minorities in our community. And I'm very excited about this. Having a luncheon on November 5th, where we're going to use it as a kickoff and brainstorming session with staff, and we've been doing a lot of one-on-one interviews and small group exercises leading up to this. So this is that other part again of trying to create a community that mirrors this social capital of inclusion and diversity. So all hopefully comes together in a way that creates a stronger community. So do you have any questions?
Is the consortium open to you?
We are focusing right now on those groups, but yes, if the VA wants to get involved, we are certainly interested in that journey. Yes?
The no-bite video is great. My question is, how are you using it?
We did a press release about our Buncombe County website. We used it with staff to get the message out. So would you like to use it in your doctor's office?
Well, I'm just thinking beyond that of, wider distribution. How could that happen? Just raising the question.
Yeah, no, I love it. As pollinators of the community, if you all have a waiting room or some place that you would like to put it on your website or newsletter, that's exactly what we hope to do. So, yes.
It's on YouTube, so we can link to it.
Lisa, I just make a comment. I am very proud of Buncombe County when I see things like this. I just want to say that publicly, that these are the kinds of things that I believe will pay off in the future. And while they may be difficult for you to navigate now, I believe that in 5, 10, 20 years, these efforts will be recognized as having been monumental in the growth of this community.
I hope so.
I think the listening speaks to all of us.
Yes.
We need to listen just a little bit more to those that we serve.
Clearly, from what you heard today, there's valuable information in listening.
Great idea. Why couldn't that little clip be used with the weather report in the morning and not on the local news?
I think that would be great. The news actually did take it up, and they showed parts of that as well. They came out, Charlie did a really good job, but to have something like that would be a good idea as well. It just made me so proud of school.
So I'm not sure where I did view it, but I have already seen this.
Yeah.
It was, it must have been on, I don't know if it was on Facebook or if it was on buncombecounty.org, and I haven't seen every video, but I remembered this because it was just so adorable, the kids in it, and simple message delivered well, but out a while.
It has.
A couple of months, probably.
It has.
Yeah.
I don't know about you, but like I look on my back porch and I'm like up to the toss. I'm out there getting rid of the water.
Sam Champion and Robin Roberts would show.
There you go. Any other comments or questions?
You did a good job in that way.
Thank you, Lisa.
opportunity to be at one of these meetings for the community advisory group, I guarantee it is involvement. It is a stirring group of people who are definitely giving information that is needed for this community. And I've been impressed each time I have been there. And when I was watching the clip on the young people, I could just think about the people on that committee doing the same thing because they are so involved and so interested in what's going on. But that's quite a group, and I think we're going to hear a lot of good things and get some good information from them in order to help us with what we have to do. Thank you.
Thank you. Thanks to Frank and Terry, the co-chair that group with me as well. That's it for me.
Okay, Mandy?
For director's report today, Gibby's going to lead that component of the presentation and give an update on the community health improvement plan. While Gibby's coming up, Krista can resend the link to board members when all the advisory committees meet and who the members are. And please, as board members know, you're always invited to attend any and all of those and on all of the advisory committees. And Gibby's going to talk a little bit about some of the work with public health advisory committees.
I'd also like Lisa's PowerPoint. If she could send that out as well. There were a couple of things that I missed on that.
You gotta watch Donna.
You know what? I'm all about that.
Yeah, it's a good thing. What I'm here to talk to you about today, and I'm not going to talk for just a minute. I'm going to turn it over to our advisory committee members who are here today. The members who are on this board. We have been working, last year we committed our community health assessment in 2012. Y'all have seen that. And the next step was to create priorities, which we have the 4 priorities, and you've heard those as well. Now we're a little bit further along in what we call the community health improvement process, which includes planning. And we sent you some information about the plan. You've got a document in your packet that gives you the information about what has come together in that plan, about the strategies and the goals that have been identified under those 4 priorities. In addition to that, there's another document at your table today that is sort of we have PARs around other things that we do in the department. This is a sort of a beginning stage of a way for us to update you on outcomes from the work that's coming out of this. This will probably morph a little bit. These are big targets that we have here, and before too much longer we'll have some more intermediate targets so we can give you information more than just once a year. But just wanted you to see that. We have 4 members of this board who are currently serving on the Public Health Advisory. That's Suzanne Swanger, who is one of our co-chairs, as well as Don Locke and Stephanie Kaiser. The other one is Richard Oliver, who is not here today. So I'm going to turn it over. Don, I think you're first.
No.
Or Stephanie first, I'm sorry. So Stephanie, and then Don, and then Suzanne.
So I don't have an adorable video to show. I thought it'd be easier if I just came up to the front, and Dawn encouraged me. So I'm going to share with you a little bit about the work groups, and Dawn's going to share more details with you about the actual council, Public Health Advisory Council. But the work groups, so imagine a room full of all of you passionate about one of the items listed in front of you. So we'll pick tobacco as an example. And you've all got major, wonderful ideas and initiatives happening in the community. So then, picture one of our staff, so who's the lucky person? Our tobacco person isn't here right now, so where is she? No, she's going to the state to do wonderful things. But, so then there's a staff person from Buncombe County who is, quite frankly, in my mind, I did have the herding the cats thing. So in my mind, I'm envisioning all of these very powerful, influential individuals who really do have the greatest ideas, but needing to come together and come to some alignment about what will we do in this community to address and work on this initiative collaboratively. Now, what the county is not doing, the county is not taking away the individual identity of these work groups. So if you are that wonderful nonprofit, you are making great strides in your local little community where you live, where you reside within the county, you can continue to do that great work. But please share that great work with others so that these other initiatives could also learn from you and perhaps better their experience and or perhaps add something to that experience. So for work groups, that's how I envision that. Again, another one that I sat in on is I have staff and missions, and one of the things I'm committed to doing is making sure we have mission representation on all these. All these are health-related issues, and just finding out, so who's going, are they attending, let's make sure we're contributing as we should be. But it is amazing to sit in a room full of people who oftentimes aren't health providers in this community, but they are passionate about the impact that health has on the people who reside there. So the work groups are feeding a lot of powerful information up to the council. And I can share some of that with you. They're also getting to know one another, and as you listen to Lisa's presentation, I thought it was quite frankly a perfect lead-in to describing work groups, because it really is about negotiating with one another, learning who you each are, listening. Had an experience this week where saw that listening perhaps not happening between two individuals. And you know what? They're working through it and moving past it, because the goal is to improve the health and the experience for our community. So that's the work groups.
I've been trying to think of whether I was a worker bee or I was wrong. It's been going through my head. I don't know what I am. I'm not quite sure. I'm just a pollinator. But one of the things that I want you to do, all of the members of HHS, is I want you to look at this sheet, and I want you to know the elevator speech for which HHS has agreed to be responsible, and which I hope you're going to vote to endorse today. So if someone says, what are we focusing on in Buncombe County? I want you to be able to say healthy living, tobacco prevention and cessation, preconception health, and early childhood development. That's all I need you to say. I need everybody to do that. And I'm likely at the next meeting to come up to you and ask you that. So that's your homework assignment. And we're going to have some people visiting our community in December, and I hope that they talk to you, that you will manage to do that speech for them. And those of you who work in the area, I know you can already do these things because you've been hearing them a long time. But the Health Advisory Committee has as its primary responsibility to pull all of this together. You receive the plan in the mail, and I'm not, as an attachment, I'm not going to read any of that to you because I think it's 114 pages long. Is that right? About 114 pages. There's a lot of stuff in there. We have endorsed that plan because we have gone through it, looking at the bigger picture. When all of these folks came together and told us what we needed to be doing after we had done our community assessment. You remember we talked about that. We did the community assessment. And now we're in the process of saying these are the needs of Buncombe County. And from that list of needs, we want to focus on these 4 areas. And those are going to be what you're going to have your elevator speech ready to talk about. But we are responsible then for becoming advocates for these areas. Because that's what, as we see programs developing, one of our members said something that just really resonated with me. She said, at my meeting, I took these items, and as we were going over our agenda, I asked, how do we meet each one of these in our organization? That's one way of getting that in there, and one way of advocating within the organization. I think some of you know that Stephanie, Giddy, Allison Jordan, and Marion went to Greensboro for a week-long training with Robert Wood Johnson. I wanted to say Robert Wood Stevens. Robert Wood Johnson. On how to expand our boundaries as we're working with with issues like this. And that's really what we're trying to implement. So at each of our meetings, we try to do something that we learned in Greensboro. And I love your exercise. Those are the kinds of things that really resonate with us. We have 20 people on our Health Advisory Committee who are doing a wonderful job representing a broad section of our community. And from business, from environmental planning, medical, higher education, agriculture, we've tried to connect everybody we can because all parts of our community have to identify with these 4 things. That's what we're going to focus on now. We're going to focus on everyone has to be on board if we're going to make significant inroads into resolving some of the issues that we have. We came up with a plan. We've all read it more than you'd like to know. We have voted to endorse it. And then we had to do, I'm learning all these things that, how systems operate. It had to be submitted to the state because each county has to have a state plan. So we submitted it to the state, and guess what? It didn't pass. No, it didn't. The state gave us accolades for what. Just to see if you were awake. Gibby almost lost it. But the state has already approved it. But we need you to approve it as well. We need to have our county HHS board because this is something, and we're sort of learning how to do this combined HHS this year. So it may seem like it's a little late to come to you for approval, but we're learning how to do this, and we have state deadlines and things that we have to meet apart from this meeting. But that's what Suzanne is going to talk to you about. But I think this system of a combined HHS with the Health Advisory Committee is working well. And I'll entertain any questions if you have. Okay, thank you. I'll turn it over to Suzanne.
We have had wonderful conversations and bringing many groups from the community in to tell us about the health needs. We understand that we have established baselines, but we know that those will change and that we will get more specific and more measurable in the work that we all do. And we hope that you will use this information to carry the message out to the community partners that you have. Mr. Chair, I would like to make a motion that this board accept the community health plan as presented today.
Second.
Move second. Any questions from anyone? If not, then I would like to, all those in favor say aye.
Aye.
Opposed? 100% for.
It is a lot of work, and I would like to thank our groups here today. Also, a bit of good news for our community as a whole. Part of John and Stephanie's work, and Gibby and Marion, as he mentioned, the trip to Greensboro, the Robert Wood Johnson Foundation has a grant that they established and award to communities for the community partnerships and the work to make the community better for everyone. There were 253 communities that applied, and Buncombe County was selected in the second round and now the third round, and there are 12 finalists. And I thought this group would be interested to know that we are one of those 12. And also in North Carolina, Durham County is on the listing. We have systems in Texas, Ohio, Alaska, New Mexico, Maine, and Washington, and Louisiana. So we will be expecting a site visit, and then 5 or 6 communities will be chosen as the recipient of the Roadmap to Health Prize. And it's not a lot of money, but it's good recognition for the work that everyone is doing to make Buncombe County a healthier place for its citizens. So we look forward to sharing good news with you in the future regarding this work. And if you would like to be a part of this, see Gibby and Marion, and I'm sure they'll take any volunteers. That's all.
That's why you need that elevator speech when that committee comes to visit us in December. That's when you need to be able to articulate that.
I'm sure, Don, you'll remind us of this again.
I will. Gibby keeps reminding me.
Okay, thank you.
I had just a couple more things. I too want to thank Lisa and her team and the board members who serve on that committee, and most of all the consumers and community advocates. What a great piece of work. I think recognizing the work that Ken Putnam did, I really appreciate that Ken left, thought of that idea, made it work through this system, but I want to recognize other board members have done very similar things. Sharon was part of a presentation on veterans that really looked at sexual trauma in the military and has pushed us, not always so gently, that we needed a female presence among veterans service officers and somebody with that particular skill set. And we heard that voice and have worked hard to accomplish that. You know, I think Stephanie began doing some work with the sheriff around their wellness program, because there's a lot of research that says first responders are challenged related to wellness issues, and Mission faces many of those because they have employees who work in high stress areas and do shift work. Van and had Mission come up with what we think is a much more effective evidence-based wellness initiative for employees. She brought it to me because I'm assigned the financial side of that in the county. And I loved it, took it to Wanda and said, I want to do this too on the health and human service side. And Wanda said, I want to do it countywide, so we shall roll it out in December. And I think as Mission's able to get more of the larger employees aligned in their wellness initiatives for their own workforce, that's very exciting for us as a community, and that's that social capital piece that I'm very grateful. I said it in the beginning. We chose this board not only because there were required expertise, but for you as individuals and the passion and the expertise you bring. And so we were very grateful for that, and I wanted you to hear that. I want to touch very briefly. We had an unexpected visit from the Secretary of DHHS. She might have wanted out of Raleigh and out of the news, but she wanted to come and see how we were doing related to NC Fast, because we're outperforming most urban counties, and that isn't anything to crow about, let me tell you right now. But she also wanted to see integrated health and human services, and she said she wanted to spend about 45 minutes, and she brought a group of staff and stayed about 3 hours. And I think she has since talked about in many settings across the state that we really are the model for integration, and it really, that our commissioners have really led it in a way that's not about authority or power, it's about focus on better outcomes for the community and how we serve individuals. So I feel great pride in the fact that she's talking about that across the state. Also wanted to say that when we did the Affordable Care Act presentation a couple of months ago, at that time the direction from the state was that we didn't have a role in that. They released policy last week that said we were DSSs were to assume the leadership role in the Affordable Care Act, and how, right in time for October 1st, and how we connect individuals to insurance options. Lisa's team has done a lot of communication on that. If anybody wants copies of those, we've done cards with a website and some basic information, some flyers. We have a whole website dedicated to it, and we'll have navigators in the lobby at Cox who are helping individuals navigate that system. I think when Steve does his orientation for this board, which might be, is it next month? Yeah, I think we'll actually do it at Cox, because there's still many of you who have not seen that integrated system, and we really want to do that walkthrough and have you experience what it's like for a consumer who comes in there, and some of the outcomes we're achieving. So those are the main things I had to share.
Well, that's wonderful. Always good news from HHS department. Thank you so much, Mandy. Our next thing is public comment, and I'm not going to be able to say hallelujah today because Jerry's here. So, Jerry, you like to say something?
He's being good today.
He's being good today?
You're being good today. Stay that way.
Yeah.
Okay.
You want to say something?
Yeah, thank you, Bill. If you laugh at Bill, it's the last meeting, laugh at him at this meeting, because Bill and I are friends and we'll remain friends. So there's no hard feeling between us when we joke at one another. So if we can't joke at one another, then we're not friends, are we? But anyway, health and human service has always been a heartfelt thing for me, because I grew up in church. And I know we have Mr. Commissioner here from my hometown in Candler, and he knows the people, a lot of them that I grew up with. So He understands that environment, and I just wish that Health and Human Service could be put on the map for what it really is. The commissioners would be put in the back room more or less if Human Service was put out front, because without Health and Human Service, we're nothing. Because if we're not in the business of helping one another, we're not doing what we should do. Not as a community, as a person, or agency. So what I would like the commissioners to do, since we have 2 years we can talk to them, is I think the way to reach out into our community and make Health and Human Service better is kind of like when you cross the state line, anywhere you go, you got an information center. I think if we could set up information centers in each of the counties, each of the districts, like school districts, but don't name it DSS, don't name it Human Service, have an information center, kind of like a tourism development. When you walk in, you got all kind of literature to look at, pick from. You could just have choices, but at least have substations like that set up. I think that would be a way of getting the message out. And if we don't get on the technology end of it and get the information out, we ain't gonna get it out. Because that's where the kids are, that's where the adults are, and that's where the future is. And one other way is on the e-letter going out from the county commissioners. That'd be a good way to put our advertisement on our Health and Human Community Service side too. And thank you very much.
Thank you. Jerry, do you have anyone else from the public who wishes to speak? Okay, then I'll say hallelujah again, because we're going to end out a little early today. That's even more wonderful. Do I have a motion?
Absolutely.
Can I just make a real quick announcement? Because I think it would be of interest to you all. The Community Foundation of Western North Carolina is bringing a speaker on October 24th, a gentleman by the name of Jim Johnson, and he's going to be talking about demographic trends that are causing disruptive changes. And I think it would really be helpful to the work we're doing here. It's free, it's going to be at UNCA, but you do need to register in advance, and it's on the front page of their website, which is communitycfwnc.org. I have heard Dr. Johnson speak, and it's an entertaining presentation, and it's really changed the way I think about some things. So thank you.
Thank you very much, because I too have heard him, and it is very good. You see, you'll put that in, Chrissy, you'll have that in the minutes there, Sue, for that'll.
I will.
Any other announcement? If not, I entertain a...
Absolutely.
Winnie's back.
Winnie's back.
Second? Second. Second? All those in favor? Say aye.
I think you need to tie it on. You got it early.